everyone, Kristen Welsh here with Mon Health. Thank you so much for joining us tonight for Facebook Live Same Day Orthopedics. We are so excited to have you, three of the finest here, to answer your questions and talk all about same day orthopedics, what to know. I know maybe if you're a patient and you have some concerns, we're going to cover everything you need to know when it comes to same day orthopedics. So we want to start off, introduce everyone here who is joining you for Facebook Live. First, we have Dr. William Post, orthopedic surgeon, and we have Stacy Ferguson, who is an RN and administrator here at the ASC, and then we have Dr. Nick Servos, who is also an orthopedic surgeon. So we thought we would just kind of open it up, introduce them, and have them tell a little bit about themselves to you who are viewing tonight. So Dr. Post, I want to start with you.
Sure. Thanks, Kristen. Sure. Well, I've been an orthopedic surgeon in Morgantown since 1992. And I grew up in Reading, Pennsylvania. I grew up playing every sport coming and going, and wanted to be an athlete when I grew up. And when that didn't turn out, then I decided that a sports medicine doctor might be the next best thing.
There you go.
And I've been very blessed to have that come true, and to do orthopedics here, and now at the ASC. It's been a wonderful thing.
Great. Stacy.
Well, I'm Stacy Ferguson. I have been a nurse since 1991. I started off in hospital floor nursing, and I was lucky enough to be in the right place at the right time 20-some years ago to start a surgical center in Martinsburg, West Virginia. I got a call 5 or 6 years ago from a group up here. I came to Morgantown, fell in love with these guys and with the area, and decided, hey, well, let's try one more, and here I am, so, in our new surgical center.
Well, we're so glad.
Thank you.
All right, Dr. Zervas.
I'm from the state. I grew up in Glendale. Like Dr. Post, I played a lot of sports and broke a lot of things and dislocated several things. I went to med school not knowing what I wanted to do, and then after all the training I got as a kid, I decided orthopedics was where I needed to put my hands. And I've been working here in this city here for, I guess, 20-some years, since 1997. And I enjoy my job. It's a great job to have because you're always helping people. And the majority of the time you're able to put somebody back together or make them happier. So
Yeah.
it's a good satisfaction.
And you've experienced it yourself.
Yeah,
So you're able
too many times, and I'm paying for it now.
Yeah.
So
You're paying for it now. All right, perfect. Well, let's get into some of the questions that we have. Obviously, you can see we're in a very beautiful setting tonight for Facebook Live. So we are at the ASC. So Stacy, the first question really goes to you. What is this place? What is the ASC, and really what are the benefits here?
So an ASC is an ambulatory surgical center. We're a modern state facility that focuses only on outpatient procedures. So in this facility, we're doing orthopedic procedures, plastics procedures, reconstructive procedures, and pain management. We've been open 4 years now. 4 years. We did our first surgery in February of 2017. And it's been growing all along. We started off with just some small procedures, and now we've just recently in the last year started a total joint program. We've done basically about 100 total knees, and we're starting into total hips and total shoulders. So.
Perfect. Okay. Dr. Post, next question is for you. What are the advantages of the dedicated outpatient surgery center, and what can a patient really experience here?
The first part of that is a really important question. And you say, what's the advantage of a dedicated surgery center that's outpatient? It's just like so many other things in life, Kristen. When you do something all the time, you tend to learn to do it really, really well. And we have, anesthesia staff here, we have nursing staff here, our surgical staff here. They're totally tuned in to making the outpatient experience not only pleasant for the patient, but efficient. And so, like Stacy was saying, we're starting to get more and more kind of major procedures, total joint replacements. And there's not really any compromise in the surgery. It's the same kind of surgery exactly that we would have been able to do in an inpatient setting for many years. But in the setting like this, with the anesthesia advances and the nursing advances, patients can go home. And they can go home comfortably, and they can have a quicker recovery. So the whole thing runs much more seamlessly in a situation for the patient. So you say, what is a patient experience like? Typically, they'll come in here. There won't be a long wait for them before surgery. They'll meet people that are friendly and well-informed that can answer their questions really well. And before you know it, they're like, what do you mean my surgery's over? It's time to go home? And they go home, and the helper's here, and the doctors call them the next day to make sure they're okay, and they just love it. I mean, the responses that we get and the feedback on the questionnaires is overwhelmingly positive.
Yeah, when you explain to a patient that they're able to go home that day, can they just not even believe it? Because I think a lot of patients maybe fret over surgery, but to know that they can release that day, is it something that they're very optimistic about?
They are. I mean, they're not too surprised about it, but they're often very reassured about it because they want to be home. Sure. There's an anxiety that goes with being in a hospital or it's a little bit out of control for a patient. When you're at home and it's your own environment, especially if they're educated well ahead of time, which is one of the keys. So when they go home from their surgery, whether it's an arthroscopy procedure or a joint replacement, if they know right away, this is what to expect. When I go home, I'm going to do this and I'm going to do that, and these people are going to call me and I'm going to be in touch. They feel very connected and safe in a way that they don't if they're in a hospital. Not to mention the whole COVID exposure question.
Right. Yeah, and those are questions that we have coming up in just a few minutes. So Dr. Post and Dr. Zervos, really both of you want to answer these, really moving towards joint replacement. Which patients are best suited for outpatient surgery? And for those patients, what are the advantages of really outpatient joint replacement?
Well, before we took this program up, we had a lot of research going into it for the several years ahead, and we weren't really allowed to do them by the state. Once we were allowed, we prepared and we went around the country, specifically Ohio, where they had a big complex where they did this, and asked them how they did it, what their preparation was, and we undertook that. So in the early part, we were like, we better pick the healthiest, strongest people with help at home, and it has expanded, I think. Now we're pushing it, not so much pushing as much as you say, as realizing that most people, if they have somebody with them and they have the therapist there, with the anesthesia we have provided, there's very minimal pain with this procedure now, where it used to be when we started, we were loading people up with all kinds of narcotics to get them through the first 48 to 72 hours. Now, the blocks we have, they're lasting 4 days, getting you through the real bad part. And we talked earlier, before this started, that a lot of our patients are taking just Tylenol, Motrin as the pain management post-op, not taking any narcotics. Now, some do, but they're not taking nearly what they used to. So I think most patients with a health, to be able to have a procedure, not have a health compromise, can have this procedure in an outpatient setting if there's somebody with them at home.
Yeah, do you have patients who really fear possible pain, and that's what keeps them from getting a procedure done?
That's a really, really wise question, actually, Kristen, because some of the research has actually shown that fear of pain, when people have studied that ahead of surgery, is a very potent factor for what they perceive afterwards. So if you can reassure them and teach them that the pain is not going to be severe, and that if they do have pain, these are the steps that they have. They have pain medicine to go home with. They have the things, but the fear of pain is something that's very, very important to control ahead of time.
Yeah, I had a patient more recently. So she's been my patient for years. I've taken care of her son, her daughter, her husband, and she's been getting shots and injections like a lot of people do for years, and her knee just was beyond repair. Couldn't do another shot, wasn't helping, and I asked her why she hadn't done it. She's like, I'm afraid of pain. She actually said, I'm scared to death of the pain. And I told her what we have accomplished, and it was recent, this year, and I told her I've had the last 6 or 8 patients have not taken a pain pill. And then she agreed to it, and realistically, she's now 6, 8 weeks out, and she's ecstatic. She's like, I'm so glad you talked me into this. I said, you waited for the perfect moment, though, to where we were able to do it without pain.
Gotcha.
So,
okay,
yeah.
That's great. Next question, we're going to get into COVID, the question. And really, if any one of you want to answer this, the question was, should I delay my care because of COVID? What are your thoughts?
My thoughts are you need to do what you're comfortable with. Here at the center, we are screening our patients. We're very diligent in our efforts to mitigate the spread of COVID and to prevent patients from coming in that are COVID positive, so we're testing, we're screening. Our family members are at this point still not allowed to come in with the patients, so we're socially distancing and doing everything we can to mitigate spreads. But I would say you have to do what you're comfortable with, not what somebody else tells you to do when it comes to that decision.
I think those are all wise precautions, but one of the other questions too is, and of course I don't know this particular patient situation, but there's some situations where a delay in your care can actually be harmful to the patient. Something might not be able to be fixed as well later. And so you do need to take that into consideration too. There are some things that could be fixed just as well, whenever the pandemic is clearing. But so you have to take that into consideration too. But like Stacy said, it's an individual decision, and like everything in life, you weigh the risks and the benefits.
Sure. And like Dr. Zervis, do you have patients who are coming to you wanting to put things off because of COVID? What are your thoughts?
For the majority, we have a lighter clinic schedule because of the COVID, I think. But most people, when they do want surgery, they are signing up. I reassure them that the precautions we take are very significant, and I think it's very safe. In this situation where you're not in a big facility, where there's a lot of people running in and out, it's the same consistent group who are, checked and will not come in if they're sick. So it's a small number of people in the facility that you're exposed to at all. You have a pre-op nurse, a post-op nurse, and the anesthesiologist. That's about it. And me, and I'm hopefully not going to pass anything. Yeah. So.
All right. Thank you. Dr. Zervis, next question, and I think all of you can really answer this. Dr. Zervis, this was directed to you. What is Joint Camp, and who qualifies for it?
Joint Camp is what a lot of facilities that run these outpatient programs will do. And it's basically a way to come in and experience what you're going to experience later ahead of time, to give you advice on what to expect, how to prepare your home. Your significant other will be there too, learning what's going to happen and transpire so you're not caught off guard. The physical therapist is here that runs the therapy program, so you know what's coming and how to do your exercises ahead of time, so you're not learning when you're at home, when you may be coming out of anesthesia a little bit or just confused or tired. And then the anesthesiologist is here to tell you about the block and how it works and what to expect and how to prepare. So it's a way of getting the education ahead of time, which education is good for everybody.
Okay. Stacey,
So much better than a piece of paper. You can't just send somebody home with a handout and expect them to get it right every time. And it's kind of like the other things when you asked me before, why is NASC better? Or it just goes back to that personal part of it. They come here and then there's a level of comfort with the people and with the process. It's really, really key.
So the next question that came in, speaking of comfort and in helping people, especially whenever they leave, what kind of advice and how do you help loved ones who are with the person who had a procedure? How do you help prepare them for how they can help the patient once they get home? What direction do you give them?
The caretakers are always involved in the discharge instructions. If it's a bigger procedure like the total joints, they come to total joint camp with the patient. So we always encourage the family members to be part of the entire process. Right now with COVID, there's some restrictions, so we wind up calling them rather than them being here. Okay. But they are always a part of the physician telling them how the surgery went, what he found. They're always part of that. And then the nurses go over all of the discharge instructions and answer any questions prior to discharging the patient.
Great. Okay. Dr. Post, next question. What about pre-rehab? What can patients do to prep for their procedure? What does that look like?
I think that what you're talking about to get out of the realm of lingo for a second, pre-rehab refers to some exercises that people can do, specifically with knee replacement and hip replacement, so that they can maximize the strength that they have and improve their motion before surgery. And those exercises are often very similar to what they're going to have afterwards. And so if they get into that and they start that, and there's been good evidence, good research studies that have shown that that can facilitate better improvement. So it's just one more thing that we do to try to stack the deck in the favor of the patients, because that's what we're doing.
Gotcha. Okay. And this kind of goes along with it. It may have been flip-flop, but same-day joint replacement, how fast can someone be back on their feet? What does recovery look like?
Well, I mean, it depends on the patient. Everybody's different, but most people are on a walker right off the bat just to control the pain that they may have. Also, the block itself will kind of make that affected limb a little weaker, so we encourage, while their block's working, they will use their walker so they won't have a fall or an incident. But I've had people show up 2 weeks out to get their staples with the walker, barely using it, or with a cane, and some don't have a cane. By 6 weeks, most people are ambulating without any assistance, walking down the hallway without a limp. Swelling's most of the way out, and the majority of the time after that, it's working on strength and motion to get your full function of that knee. But yeah, by 3 months, most people are happy and being discharged from the clinic.
Let me just add one thing, because Dr. Zervos and I and Stacy have mentioned several times about the block. Mm-hmm. So like, what is this block thing? What it is it's the anesthesia doctors have learned a lot over the last decade or so about how to stop pain before it starts. And so what the block is it's simply an injection of a long-lasting local anesthetic, a numbing medicine, that they put around the major nerves in the extremity that take away the pain so the patient's body doesn't feel pain during surgery. And therefore they need less general anesthesia. They don't have to be put as deeply to sleep. Okay. And so by stopping it before it starts, it becomes less overall. But that's what the block is. And the anesthesia team that works here is tremendous at that. And that's so important to patient comfort, but also to patient safety. So that's the point, is the nerve block that we talk about so much as being key to this, is the numbing medicine injection that can last 2 to 3 days.
Yeah, and I'll add to that. Like, we've learned through this year about these blocks while we're working. Currently, a lot of the patients, you've seen it, if they're healthy and have a good airway, the anesthesiologists with their block are able to just do a sedation without intubation, almost like a lot of people go through colonoscopy now. So not getting a lot of anesthesia at all.
Right.
Which, when they first start doing, I'm like, what are you doing over there? Like, well, they don't need as much, so we're just adding the local supplementation what we do ahead of time, and they're very minimal anesthetic. So they wake up quicker, they get moving quicker, and they get home quicker.
Wow.
And with less pain, which it's amazing.
That is amazing.
It truly is.
The patients are on their feet about an hour after surgery. We walk them several times before they leave.
They probably can't even believe they're on their feet already.
They expect it because of joint camp. But otherwise, they're always shocked. They're like, oh, wow, I didn't believe you. Yeah. But yeah.
Yeah, we do hear that a lot.
That's wonderful. Okay. Next question is COVID again. The question is, what precautions are being taken at the ASC to really protect patients during COVID? I know we kind of went over that a little bit, but if you want to reiterate. What precautions, yeah.
We are screening our patients. We test for COVID for patients that are going to have airway manipulative procedures, disinfecting the facility, social distancing, keeping family members outside of the facility right now while COVID is really high. Masks, PPE, you know, all of the CDC guidelines. We're following all those and all the best practices. We have not had any spread of COVID in our facility to date.
And, you know, a big part of that too, I think, Kristen and Stacy, you probably would agree. But we carefully choose the patients that are coming there, and they're screened ahead of time. So it's not like a hospital setting where you have people coming into the emergency room all the time, and because they need to be there, and that's what it's for. It's for people that might have COVID. But you don't have those kind of people coming through this facility. You have patients that, you have patients. It's not an uncontrolled, it's a public place, but it's a controlled public place. The people that are coming are very carefully screened. And I think that's why we've been so fortunate, so blessed to not have an issue with COVID.
Sure. Okay, perfect. Thank Thank you. The next question is, should I rearrange my home to be safer to navigate after surgery? Great question.
Absolutely. I mean, the goal, and I think they do go over that in camp, is to make sure there's not as many steps or stairs to get to where you need to, make sure there's access to the bathroom facilities, there's room for your walker, there's not a lot of carpets around that can trip you. You have a comfortable place to lay down that you can get to, and hopefully that's managed ahead of time so you're not in a dire situation when no one's there to help and take care of it. Yeah, and that's something, information we give to help them. So
That's all.
yeah, it's all pre-opt ahead of time in the joint camp.
Perfect. Joint camp has been very effective, would you say?
It has, and it's been really well received by the patients. They feel they get the connection with our facility, with our staff, and they just feel like we're taking that extra time out for them to explain everything they need to know. They're in a nice group setting. They can ask questions, benefit from other people's questions as well. So it's worked out real well.
And the patients really like it too. And I have to kind of throw Stacy a bone, no pun intended, but you know, she works above and beyond. This joint camp thing happens in the evening. And Stacy and her staff are here like all day long, and then they gear up and they put on this educational thing in the evening. I mean, it just goes to show, honestly. Don't get a big head about this.
I'm ready to cry. You're going to make me cry.
Oh. All right. Well, there we go. I made you cry. Now I'll make you laugh, and it's just the way we roll around here, I guess, isn't it?
That is great.
But
Thank you.
it honestly, you know, all kidding aside, it goes to show that what caring people that she has working here, and she in particular, you know, just above and beyond to answer patients' questions and be on the phone with them after procedures. And yeah.
Sure.
Good job, Stacy.
Yeah. Thank you. Because surgery is a scary time for anyone, so they have that extra comfort and they have that guidance from joint camp. Seems great. Okay. All right. Well, thank you for all the questions. Was there anything I missed? I want to make sure we don't leave anything out. We had a lot of great questions tonight. Anything else you all wanted to address?
No, I think everybody who would, if you'd ever talk to anybody coming through here, I think they'd be highly complimentary of the staff and the way this runs.
Yeah.
It's one of the best things that's happened in my career to be able to work here, honestly, and to be able to take care of patients here, and it's just much more efficient, much more helpful, I think.
Wonderful.
So I think it's the future.
Wonderful. Dr. Post, Stacy, Dr. Zervas, thank you so much.
Thank you.
Appreciate it. Thank you, everyone, for your wonderful questions for Same Day Orthopedics. We appreciate it here at Mon Health. Have a wonderful evening.